I'll just introduce everybody first. I'm Jordan Robertson, reporter with Bloomberg News. I'll be moderating. Wanted to introduce everybody else as well. We've got Bob Gregg, CEO of ID Experts Corp. We've got Ron Ross at Nist, and we've got Aaron Titus, Chief Privacy Officer at Identity Finder. And the topic today is going to be organized crime and the value of medical information to organized crime. We've got a lot to say about the topic, but first I wanted to let these guys introduce themselves and tell you a little bit about what they do and how it pertains to the topic at hand. A little bit about more about myself first. For the past year or so, I've been writing a lot about medical data, health data. Those of you who saw the presentation earlier today, we had a big project come out today about the security of state hospital discharge data. I've done a number of stories over the past year with the help of some of these folks on stage about medical identity theft and some of the consequences of that crime. So this is a topic pretty near and dear to my reporting interest. So I'll let these guys introduce themselves and tell you a little bit about what they do.
Thanks, Jordan. So I'm Bob Gregg. I'm CEO at ID Experts out in Portland, Oregon. Our company, we're about 10 years old, and think of us, we're the leader in the prevention and remediation of privacy data breaches. And we made a decision a little over 3 years ago that 100% of our efforts are going to be focused on healthcare going forward. So everything we do now is focused on providers and insurers and anybody who deals with protected health information. And obviously this topic is very, very fascinating to me because it's kind of the new hot thing that's happening out there. And actually when we come back here, I've got a couple of colleagues here with me, and we'll meet with the Secret Service and the FBI, and they'll tell us that this problem is just getting to be enormous. So we're going to have an interesting talk today.
Hi, I'm Ron Ross from Nist, National Institute of Standards and Technology. For those of you who aren't familiar with the acronym, we're part of the Department of Commerce. And within Nist, I work for the Information Technology Laboratory and the Computer Security Division. We develop and build all the security standards and guidelines for the federal government. We also service the Defense Department and the intelligence community. We have a partnership where we work pretty much nonstop against a very sophisticated set of threats today and adversaries. Recently we got into the privacy business with our security control catalog, 800-53. It's a federal guideline that's tied to what we call a federal information processing standard. That's the FIPS in our world, not the FIPS that you're familiar with, the Fair Information Practice Principles. And we are literally moving into the privacy control space in a big way because it's very tied to security, and it's very linked to the adversaries that are really playing havoc with all of our public sector and private sector systems. There's a massive exfiltration of information from these systems, and we're doing everything we can to try to help our customers protect themselves. So glad to be here today, and we'll talk more about the privacy controls, I'm sure, later on.
My name is Aaron Titus. I'm an attorney. I specialize in information privacy law. I'm also the Chief Privacy Officer for Identity Finder. My background, so I'm the Privacy Director for the Liberty Coalition, which is a DC nonprofit, and in that capacity I was focused primarily on data breaches, and over the years I've personally discovered somewhere around 2,500 breaches of one sort or another online, and it would always just irk me because I'd tell the companies about it and they'd sweep it under the rug, and it's like it never happened. And so I spent a lot of my work on empowering empowering victims of identity theft with actionable intelligence on what happened and what the real risks are and what they can do about it. And I would say to myself time and time again, man, if they would just scan their own servers, they'd know about these breaches before they know about these leaks before they became breaches. And that's how I got introduced to my current company, Identity Finder, and that's exactly what Identity Finder does, is it data at rest, data loss prevention and scanning. And so it's great to work for a company that I really believe in too. So so that's where I come from. It's primarily from the data breach perspective.
Right. And just a little more background about the reason for the composition of this panel is Bob and Aaron and I have worked together before on a number of things. Aaron brings a really interesting perspective from a security researcher and a privacy researcher. Bob has a lot of extensive insight into the patient experience with medical ID theft. And and Ron has really great expertise in terms of technical solutions and some of the dynamics behind how organized crime can actually be stopped. And some background about the way we've worked together before. Medical ID theft stories that I've written, a number of them, Bob and his company have helped connect me with patients whose privacy has been violated. We did a story
With their permission.
with their permission, of course. We had a story come out maybe 6 months or so ago about a patient who's been battling medical identity theft for over 10 years. It's a problem that speaks to the kind of the lack of coordination between healthcare systems, between data providers, and also speaks to the problem of how organized crime can be so effective at perpetrating fraud, perpetuating the fraud for a long period of time without getting caught. There's not a lot of syncing up of the systems. Aaron and I have an interesting background. Is when I was with AP a few years ago, we wrote a story. Aaron came to me with some really interesting health data he found on a public website through Google searches, through advanced Google searches. It involved 300,000 California patient records that were on the site of a subcontractor of a subcontractor of a subcontractor who thought he'd put it on an internal site for his own employees to use and perform analyses on.
No, he knew it was available. He just didn't think that Google was going to find it.
Didn't think Google was going to get it, and we can get into some specifics of that later. But there were some interesting ramifications from that experience that speak to why so much health data continues to be available online, and a lot of that has to do with researcher and reporter intimidation on the behalf of these companies. And really wanted Ron here as well to talk about some of the technical solutions. We wouldn't want to do a panel like this without talking about ways that these crimes can be combated. So we'll just dive right in. I think some level setting might be in order. The figure that I've seen for organized crime and their impact on healthcare is upwards of $100 billion a year. Insurance companies and the government are being defrauded by organized crime and fraud in general. And a lot of that, a large, significant portion of that is due to medical identity theft. And one of the questions I wanted to ask Bob, and we can kind of do some level setting about what is medical identity theft. I think when I first started writing on this topic, my idea was always one-to-one. It was an individual stealing an individual's medical record, using it for care, either because they couldn't afford insurance or because they were an undocumented immigrant. Organized crime is a whole other ball of wax, but I think Bob has some interesting definitions that might be helpful about what is medical ID theft, and that can help frame the discussion for
Sure. Sure, and I do want to level set. The common number out there is $100 billion, but that's kind of healthcare fraud. Some of it's organized, some of it's not very organized, but and that's just, it's literally a guess based on, the best minds in the business. That's what they're guessing it is. There's a lot of us that think it's probably quite a bit north of that, because a huge percentage of that is Medicare, Medicaid fraud. The piece that we don't really see and have insight is in private insurance fraud, because it just doesn't get out there and publicize like the Medicare, Medicaid stuff does. And I'll talk about that in a little bit. So on the definition front, so when we say medical identity theft, very interestingly, I think it was Harris Poll did a poll of Americans like 6-7 months ago, and 85% of people in America basically drew a complete blank when you said medical identity theft. They have no idea what that means. And the ones that think they know what it means, they immediately go to the financial ramifications they think of it as identity theft. So somebody steals my medical identity, they go out and use it. That's really kind of insurance fraud. It's not really defrauding me, because I'm not going to end up paying that copay, and I can probably convince them that wasn't me, so I don't need to worry about it. What people need to realize is that every single thing that person does fraudulently ends up on your medical history. And we have cases where we can demonstrate that because of medical ID theft, we put patients at serious medical risk. Blood type was different, pre-existing conditions, prescription history, whatever you can think of, it's probably happened in this space. But when we look at medical ID theft, we have two basic definitions for it. One is the normal one that Jordan just said, which somebody grabs your medical ID and pretends to be you for whatever reason. But the other one is, and increasingly in organized crime, you either go out and recruit people and get their medical IDs for fraudulent billing, or you literally can go out on the internet and buy medical identities on the internet and bill the insurance companies, Medicare, Medicaid for either services never rendered, or you can, of course, can upcode all day long and get paid, and the numbers are absolutely staggering. So when we look at it, we look at both of those buckets, and they're really distinctly different forms of medical ID theft.
And that distinction is important for the conversation, because when we talk about one-to-one medical ID theft, the consequences, as Bob mentioned, are not financial. They are potentially, if you live in the same area as the perpetrator, potentially erroneous medical treatment, which of course would be the worst outcome. But what we found in a lot of the stories that I've done, if the patients live apart from each other geographically, they won't see consequences in terms of the quality of their care or of the quality of their records. But where it gets really interesting from the financial perspective is the kind of massive medical ID theft, the theft of entire databases, where it's not necessarily the individual that's targeted, it's the database of insurance numbers.
Can I make one clarification, though? What you said is absolutely true looking back. With electronic health records going forward, that will no longer be true. You can steal somebody's identity, come back to Washington, D.C., get it done here, and you go back and have a problem in Oregon, where I live, they look up your electronic health record, they're going to see that fraudulent person's activities here in Washington, and they'll have no idea that wasn't me.
You know, identity theft broadly, and I completely agree with the definition so far, but broadly, identity theft is when somebody or some organization, somebody pretends to be you, does something bad, and you get blamed. Now, we know what within a financial context, somebody pretends to be you, and they steal your money, and you get left holding the bag to one extent or another. Within a medical context, we're talking about that now. Within criminal records, somebody does something bad, you get arrested. So, but that thread, I think, is pretty consistent, whatever the context. The real question then is what is the minimum amount of information required to pretend to be somebody else? Within the context of Facebook, the minimum context for me to pretend to be you and do something bad and you get the blame for it is perhaps a username and password. Within the medical context, it might be a little bit more information. It might be different subsets of information. So I think sometimes it's helpful to just think about identity theft within that context, within that higher level, and then what's the minimum amount of information that I need to pretend to be you within a given context.
It's a great point. It's one that's come up for us as well when we started to talk about framing this discussion. If you want to steal somebody's identity and get medical treatment with it, you don't necessarily need their insurance number. You can walk into a hospital or emergency room, get treatment, get it billed as cash, and it goes to the real person's address or a fake one you've set up. A lot of this massive scale organized crime medical ID theft, in many cases you would need an insurance number or a Medicare number, and we can talk a little bit about how some of that works in a moment. One thing I wanted to ask the panel is it might be helpful as well to kind of define where medical data exists and how it's stolen most commonly. I know you guys each have some perspective on that, but where is medical data most commonly stolen for ID theft, whether it's by organized crime or others?
You want to start with that? Well, my perspective, as fast as organized crime is growing, that's still probably a pretty minor piece of the total picture. But you could also, what's the definition of organized crime? Is a billing clerk that works in a hospital chain has access to all the billing records and all the medical IDs of everybody who's ever been there. If he or she starts systematically selling that data to people over the internet or to their friends or for whatever reason, is that organized? Some would argue it was reasonably organized. But we think of organized crime as the Italian mob family. That's all really organized, and they're doing this. Interestingly, in healthcare identity theft world, the Italian crime families aren't in it yet. Who is Euro-Asians, Russia, Czech Republic. Increasingly, more Chinese gangs are getting involved. And one thing I learned about the Secret Service just recently is they're actually contracting with the Italian mob families for protection. So that's the connection. They're perpetrating the identity theft and the Medicare, Medicaid frauds, but they're using the Italian family for protection and the muscle out on the street. So it's pretty fascinating. But did that answer your question at all?
Sure. Well, yeah, and I want to talk a little bit about as well where the data exists that's being stolen. We've mentioned some of the, obviously internal breaches are one of the most pervasive forms, whether it's a billing clerk or receptionist stealing information and selling it to friends or folks they've met over the internet. I imagine you guys have some perspective as well on where else online a lot of this data exists to be stolen.
Yeah, I think you have to really kind of start this story, roll it back a couple of chapters, because identifying, healthcare-related identities is kind of a subset of your larger identity on your credentials that are part of what we call the digital footprint now. At Nist, with our partnership with the Defense Department and the intelligence community now, we have access to classified threat data. So we get to see some of the things that a lot of you don't get to see. The adversaries out there are sophisticated. They're worldwide. It includes terrorist organizations, organized crime. It includes nation-state level attacks. They're going after public sector systems in the federal government. They're going after small, medium, and large-sized businesses. So this is kind of a generalization, not directly only at the healthcare industry. Healthcare is an important sector, obviously. But the real situation today is your data is stored everywhere. We're in a great time to be alive. We're kind of in this transformation from a fully paper-based world to a fully digital world. And in that process, we're not prepared. Our laws, just the way we do business, we haven't caught up with the great technology yet. And you can see it on the new smartphones and the tablets where we're consuming those new devices faster than they can produce them. And all that data, now we have a new term called big data. We're collecting so much data now that we had to define a new field called big data to talk about how we process and store and transmit and analyze all that. And we're very far behind the power curve. The average person in their home or in their business is not providing the appropriate safeguards and countermeasures in this digital world that we need to have to really stop some of the adversaries, whether it's organized crime or whoever the adversary might be. And they are literally ripping us off big time. Intellectual property losses have been reported up to $1 trillion. There are all kinds of estimates on how much intellectual property we lose. That could include, new designs for General Motors, or it could include, your personal information, PII we call it in the federal government, personally identifiable information. It's a massive number. And the sad part about it is that we know how to fix the problem. We just haven't gotten together as a society and a culture and our organizations to try to do the right thing. And that's one of the things at Nist we're trying to do with our control catalog. We have fully integrated a set of new privacy controls into our 800-53 catalog, sitting side by side the security controls. Those security controls are intended to be employed within the hardware, the software, the firmware, the environment of operations, providing that foundation for non-disclosure protection. So when your data is in an information system, whether it's being processed, stored, or transmitted, there are safeguards and countermeasures which we've known about for a long time, which can absolutely ensure that data is as secure as it needs to be. And so the privacy controls now are sitting side by side. They go a little further. Privacy folks worry about how much data, how long do I keep it, what can I use it for. Those are things that we as security professionals haven't really worried about traditionally, but now we're partnering because privacy and security stand shoulder to shoulder in the long-term solution. So the answer to your question is your data is everywhere. It's in big databases, it's in small databases, it's in little pieces, big pieces, and what they want typically is your credentials. You remember the Sony, the PlayStation that was compromised a while back? Well, people were saying, what's the big deal? They get the password off the PlayStation. What do you think? People don't change their passwords that much. They use the same password on the PlayStation, that Sony toy, as they use for their bank accounts. And how many of you use two-factor authentication when you do internet banking? A lot of banks now are starting to go to that, but it's slow to come. We don't want to be bothered in many cases. That's the bottom line. And so our job is to try to raise the awareness of everybody to understand what the problem. You can't fight the problem unless you know what the problem is. And so that's part of where the dialogue is going.
One of the things that the technology does exist to theoretically track and keep control, but data laundering, I guess, if that's a term we can coin, data laundering is so easy that once you take information from one system to another, it loses all of its trackability, all of its control, and you make copies, and it gets laundered. And sometimes the line between theft, laundering, and legitimate acquisition can be a little bit blurred. Well, it can be a lot blurred. You know, what's the value of this information to organized crime that gets it without my consent? Well, it's the same, roughly the same value that it is to corporations that obtain it without my knowledge or consent. And, you know, what's sometimes, you know, I think it behooves us to talk about the harms also, and it's been a common theme also. But one other point I wanted to make is that, you know, technology itself is neither good nor bad. It is efficient. Identity theft always existed. It's just that it was very inefficient to do. You'd have to drive down to the county courthouse, go up to the 3rd floor, look at you know, birth records, and then go down to the 4th, you know, up to the 4th floor, and then across the town to the DMV to get a driver's license. And you could do that, and there are people who did. It's just now technology, aggregate databases have made that process so much more efficient that it is a lot easier to do. So it also, technology makes good things efficient, and it also makes bad things efficient.
How much of medical ID theft perpetrated by organized crime do you think happens through hacking versus this kind of in-person fraud, like going to LA Skid Row, scooping up homeless people, taking them down to a fake clinic, telling them they're going to get treatment, stealing their Medicare numbers, and then false billing? It seems to me like a lot of the fraud that happens by organized crime in this area is still that kind of in-person fraud. This is probably just a case that we're catching.
Yeah. I can speak
How
to
inefficient.
that. What the FBI and the Secret Service are telling us is it's kind of on a continuum. It's kind of started in that space. Was the in-person, you know, they'd do kickback schemes where they'd hire these people that would go to nursing homes and Skid Row, just anywhere where they could convince people, hey, come with me, jump in the van, we'll go down to the clinic that happens to be run by a mob gang, and they've opened up the clinic, they've gotten a provider number, and then they bring in the people and they do procedures that generally aren't medically necessary, and they bill for all this stuff and collect it. They've now figured out we don't really need to do that. All we need to do, give them a carton of cigarettes, get their insurance number, their Medicare number, then just go back and just bill for stuff you never do. And then once you're doing that, then you can start harvesting IDs off the internet, and, you know, then you don't even need to see the people. You'll send them the forms, they'll sign them, say, yeah, this care happened, and everybody's happy except all of us taxpayers, of course. If Pam Dixon were here, I'll speak one thing for her. She would tell you that a Social Security number on the internet is worth $1 or $2. A medical identity on the internet is worth about $20. And why is that discrepancy? It's just classic supply and demand. And it's not a supply problem because there's as many medical identities as there are Social Security numbers, but it's a demand problem. And why? Because you can monetize medical identities so much quicker and so much easier, and basically without a whole lot of risk. Again, they tell us, you know, a lot of the guys that used to be in drug cartels and other crimes have figured out medical identity theft is a whole lot more lucrative, and nobody's shooting at anybody, so it's a whole lot safer. So that's what we see happening.
There's also a great increase. In the old days, if you were a hacker, it was kind of your trade craft, and it was kind of specialized, and there weren't a whole lot of them around. This explosion of technology has produced a whole new generation of hackers that don't have to be that good anymore. All you have to do is go out and get the tools from the internet. They actually have hacking conventions, and you can go out to the internet tonight. You can buy yourself an average laptop, $500, and you can go out and download all these hacking tools. They have all the stuff ready to go. So really, we've empowered millions of people now who, you know, may not have been able to do damage before. They can now do damage very easily, and it's very cost effective. And the reason why all this identity theft is so prevalent in the digital world is because it's hard to track down and it's hard to convict, and it's like the old saying is, why do people rob banks? That's where the money is. And so we've made it pretty easy. The consequence of that is our defensive measures have to really ramp up now to a higher degree than ever before. And that's why it's in all of our interest to understand all these privacy issues, security issues, how they're related, and what we can do as individuals and with our own organizations, wherever you work in the public or private sector, to make sure that we do our due diligence, to make things a little bit more difficult for the folks that want to do bad things to us.
I was thinking, Aaron, you might be able to speak to this as well. I mean, going back to the story, to give you some more background about the story that Aaron and I worked on a few years back, the database was California Workers' Compensation Appeals. And what was so interesting about this case is these were technically public documents, and the response that I got from the state, was, we can't penalize this contractor who exposed this data because this is technically public information anyway. The trick there was that this was public information, but you had to go to the courthouse. You had to go to the state office and pull these one by one, that no online database existed for this very reason. And it felt like kind of a dodge. Well, it was a dodge by the state to say, we can't police this information. It's not private information because it's technically public. And it just showed the disconnect between what used to be public versus what's now public. And Aaron, I was hoping you could talk a little bit about what you found in some of your searches, because I found that research to be so interesting that through some advanced Google searches, you're able to find this massive database, and we turned around a great story from it. It seems like you're finding these things.
Yeah, I mean, on any given day, I can do a Google search and get probably about a 1% positive hit rate off of just a Google search for Social Security numbers online. What it means to be public means something different now. When in the days of inefficient lack of technology, well, most of our notions of privacy are not necessarily based in law. They're based in social norms, and those social norms have, in large part, been the result of inefficiency of one sort or another. And so what we're seeing is technology erodes the inefficiency, privacy goes along with it. And as a privacy advocate, that's one of the things that keeps me up all night. Really, it's something that continually bothers me, is that often arguing for privacy is the other side of the coin of arguing to preserve inefficiency, and that is a losing proposition, and it's what keeps me up at night. So if anybody has an idea of how to bust through that, let me know. But with regards to, what do you find? I mean, man, I talked to an Army colonel last week who had an external hard drive connected to his personal computer that his ISP assigned an IP address to, and through some software configuration had published it as an FTP site. So there's an FTP server, and actually this is actually a pretty common occurrence. So it's his external hard drive, backup hard drive, has all of his personal documents, his W-2s and personal pictures and family movies and anything else that you can imagine that would be on a personal hard drive. And then he also had all the names and Social Security numbers and deployment dates for everybody in his platoon. I don't know if platoon is the right word, but anyway, his contingency. And so I gave him a call. I gave him a call because, of course, his home phone number and cell phone number were on there too, and explained to him and his wife what was up there, and he took it down right away. I trust that he'll report that, but I don't know. I have no idea whether any of those people who are affected are ever going to have a clue. And unfortunately, and this kind of gets to the point we're talking about, I am not in a position anymore to do anything about it. So with the story that we did, the company, the company threatened to sue us, my company, because we were hacking. I mean, after all, that was a private internet site or something. And although the grounds were, it was completely meritless, it nevertheless costed us $10,000 to hire a lawyer and a whole lot of angst. And now my CEO is so gun-shy there is no way he would ever let me do anything. I mean, he just doesn't even want to know that I do Google searches anymore. And if it is, it's just you just pretend like you didn't see it, because we cannot take that risk. And this research that I've been doing for many years, it just has to come to a standstill. I mean, actually, just last week, about a week and a half ago, there's a report in ours about reporters use Google, find breach, get branded as hackers. And it's actually exactly the same thing. A pair of telecom firms have branded reporters Scripps News as hackers after they discovered the personal data of over 170,000 customers, including Social Security numbers, sitting on a publicly available database. And it was a website. It's like, they have to now defend themselves. Now, I kind of hope that this goes to trial so we can get some case law on this to say using Google is not hacking. But we'll see.
And an important point that we should make about that as well is the story that we worked on. Aaron's searches, they were advanced Google searches, but they included common medical codes. That's how he came across this database, if I recall correctly. And part of the problem is that I talked to this company as well that posted the data. They made intimations, as well towards suing the AP, which is where I was before, for being in possession of hacked data. Clearly, that was not the case, but the intimidation from a very small firm, it can have a really big effect, and it has effectively chilled research. This is a proxy for what's happening throughout the industry. Is whenever a company that's been caught exposing, especially medical data, is contacted, first instinct generally is to sue, if they're unless they're a sophisticated company and they have legal teams that know how to work with this stuff, and that can have a really chilling effect. So, the work that Aaron does and the work that other security researchers do is, I tend to be of the belief it's really valuable in finding these databases that are very easily exploited by organized crime, by identity thieves. Finding that database, if an organized crime gang had found the database, that's 300,000 identities through a Google search. And, you run that through Medicare, you run that through Medicaid. These were insurance cases in California. That can be potentially millions or tens of millions of dollars. And all they had to do was know how to do a really sharp Google search and know what they're looking for. So to the extent that companies intimidate researchers or try to intimidate reporters, that's a really important factor in kind of why we don't see more stories on these topics, because medical data is so uniquely sensitive, and that kind of leads to some of these effects.
This kind of reminds me of the circular firing squad when we're looking for people to blame now. I have a good friend of mine, his name is Bob Bigman. He recently retired from the CIA. He was the Chief Information Security Officer there, and he now runs his own consulting firm. And they do forensics on smartphones that after the fact. And this is a statistic he spoke at publicly recently, that on 90% of the smartphones, these are Android smartphones that they do forensics on, there's evidence of adversaries tampering with the programs on that smartphone. And in 80% of the smartphones, these are the ones you're carrying around here today, the Android, if you have an Android smartphone, 80% have malware already on those phones. So another really interesting tactic of the adversaries is they have something called a watering hole. That's when you go out, they will infect safe websites, which you think are safe websites, like you go out to Home Depot or Lowe's.com, whatever you're hitting out there, and they will put their malware out there, knowing that you're going to go there. And as soon as you hit that site, just going to that website, that malware comes down to your tablet, your smartphone, or your system. And they can install keystroke loggers. They don't really have to go to these databases. They can get it right at the source from you. They can follow your passwords. They can capture everything right there. That's why we're concerned about the problem. All the things we're talking about today are kind of after the fact. The big database is small. It all goes back to the technology not being strong enough to stop some of these, or at least our controls that we're putting into the technology today are not strong enough to stop some of these activities. That's where we have to get better long term. And then we'll still have our circular firing squad, but it'll at least be less people, getting hit from that.
I believe there was a question as well?
Yeah. When you found data, is there any particular type of document or format of the data that you find, or is it across the board? And is it usually some server that just isn't being patched, or is it that there's no security on the server or the computer at all?
Yeah, I mean, you just start thinking like a lazy identity thief. You know, if you're looking for large amounts of data in an easy-to-use format, what kind of files would you look for? Well, Excel files are very common, PDF files. They come, SQL files are often posted. But if there is one consistent theme, it is negligence. Every time, I think almost without exception, that I've discovered a breach of this sort is because somebody plugged in that old server that they didn't realize had the information on it, or they thought that they deleted it, or what's actually very, very common is I uploaded it and I knew that it was up there, but I was the only one who knew it. Nobody else knew about it. There were no links to it. And then I asked them, well, do you have a Google search toolbar in your browser? Well, yeah. Well, you realize by having that installed, depending on what your settings are, you are a Google spider. Every URL that you visit is reported back to Google. So by virtue of visiting that link that only you know exists, you just reported it to Google. Google goes out and then spiders it, and then it's now available to the world through a Google search. So, but negligence is probably the most common theme.
I believe there was a question here as well.
Yeah, just one thing to camp on what you said, Aaron, about the data laundering. And if it's okay, I'm going to expropriate this term because I've been trying to figure out how to describe this.
Please do.
But by definition, all breaches are exfiltrations, and you had talked about this laundering, and things can be endlessly distributed after that, and you have no visibility to it. There are nascent, this is good news, there are nascent technologies that are mostly working in the DoD and IC now that do enable users to bind controls to their data that persist, that create an audit trail, that set distribution rules at the data level, so that things, if you say, you can look at this but you can't print it, or you can look at this but you can't extract data from it, those rules are enforced, not on the system level where somebody's got to remember to configure something right, but the data enforces it itself. So there is some technological things coming down the road that will hopefully go to solving some of these privacy issues.
So yes, you're absolutely right. But in order for that to work, it has to be, the information has to be within a system that recognizes and follows the orders.
That's correct.
And that's always where the weakness is. What we have found, at least at Identity Finder, is that in any corporation, any enterprise, any school, you have a centralized system of some sort that is, for argument's sake, secure. Now, we all know that that's not really the case, but we'll say that it's secure. But in order for employees to do their jobs on a daily basis, they have to extract information in one sort or another, either on a screen or in a report or something else, from that secure system, and make copies of it in one sort or another just to do their jobs. It's kind of like, when information is in a secure system, it's like putting money in a bank. It is safe. You can do limited things with it. You can earn interest. You can get reports, basic reports, but you can't invest it. You can't really buy anything. Information in a secure database is like that, and it simply just gets pulled out in order to be useful. And it's those copies, those shadow systems, that lack the controls because they're outside the secure system that are the cause of, I think, 2/3 of all breaches. It's those extra copies that are in your Outlook sent items, and then on that server from 2007 that you've forgotten about, and on your laptop that gets stolen, that you totally forgot about. Those are the sources of the breaches, not necessarily the secure environments. But I hope for the day when an ASCII text file has, by, I don't know, some embedded code in there that says, no, I'm sorry, you can't look at this ASCII text because it belongs to Aaron Titus.
That day is here, but it's just technology that's currently only in use at the DoD and IC in that arena.
Yeah. Actually, let me just, I'll lob one more question you guys' way, and then we'll get to a couple of questions. You know, Ron, you mentioned earlier, we've been talking about electronic medical records, and a topic I really wanted to bring up here was this idea that, you know, with the advent of electronic medical records and with the mandates under President's health reform, we're going to be seeing a lot more electronic medical records, and I'm of two minds about the value of it. Of course, there is tremendous value in having your data being able to travel with you. Also increases the hacking risk, but I was hoping you could speak a little bit about enhanced security that can be put into an electronic record that could prevent a hacking attack, especially by a sophisticated gang.
Yeah,
'Cause
yeah.
it seems like there's more possibility for it.
Well, I think to the gentleman's point, that's one of the newer technologies is protecting the data itself, encapsulating it. But at some point, that data has to go from point A to point B. Even data that's encrypted using NSA Type 1 crypto has to be unencrypted at some point. The weakness are in the endpoints, where once the data is transmitted, even if it's encrypted, it has to get to the endpoint, and that's when it gets into the weaknesses that are pretty typical in most systems. To strengthen the underlying infrastructure, it just goes back to some fundamental things that we've known about for a long time, we just don't do very well. It's understanding the configuration of your networks and your systems. It's strong identity management. You know, identity management, two-factor authentication, making sure that who you say you are when you're trying to access that data, that keeps out a lot of people who ordinarily can come right through. These passwords that we're using today are just incredibly weak, and they can be compromised very, very easily. That's why two-factor eliminates a whole class of adversaries just by using that very simple technology. Strong access controls, limiting privileges. We give a lot of privileges to lots of people who use these systems. The more people have privileges, they tend, again, to be sloppy sometimes. Maybe they're overworked, they're tired, and they make mistakes. So limitation of privileges. So when people go into systems, you only give them privileges they need to do their job and no more. And we tend to go just the opposite direction. And you can look at any smartphone, any tablet. Most of the vendors out there sell these new devices because they're trying to find maximum functionality for you as a consumer. And that goes just counter to good security. The more things we have on that smartphone, the more apps that you have, and that's another issue, these trusted apps, so-called trusted apps that are going to be accessing those medical databases from the smartphones eventually, that increases the risk greatly. But just doing the fundamentals would access control, identification, authentication, encryption of data at rest. That was the problem with the VA breach we had with the big PII incident about 4 or 5 years ago, where that good employee took the stuff home, a laptop and a hard drive, and it got stolen. 26.5 million veterans records on that one alone. And so limiting where the data can go, how much data can an employee take at one time, and you know, what are they going to do with it? Again, that gets back to privilege management. These are all really fundamental, basic things that we can do without a lot of cost, and they're pretty, they're doable, and we just need to get that done in order to. The technology is going to be limited until we know how to protect. You know, that's really the bottom line.
And if I could, you know, I love the technology, you know, going after this problem with technology, but we've got to learn the lessons that we have watched happen in the whole fraud and abuse side on financial services. You know, what did financial services do? They brought a lot of technology to fight the fraud, but they got the consumer involved. You know, how many of you gotten that call, you know, hey, your credit card says you're in Vegas, are you there? Or is it just your card? You know, we need to get to that level of sophistication so that if somebody's using your medical identity at a clinic or a hospital, you should know about that pretty darn quickly, particularly if it's an out-of-norm pattern. So there's definitely, I'll put a quick advertisement in here for what's called MIFA. It's the Medical Identity Fraud Alliance, and it's a group in the industry that trying to create, you know, get all the people with a dog in the fight to fight medical identity crime and fraud, getting them together and to get some coalition here to fight this problem, because this is a quickly growing problem. And anybody wants to know anything about the Medical Identity Fraud Alliance, just see me. I'll be here the next day now.
Let's say you actually were concerned that someone had taken your identity. How much right do you actually have to see your own medical records? If you went to an organization such as Kaiser, can you just go and say, I want to see my medical record, or would they have the right to say you don't have the right to see?
I can actually answer that based on a really interesting case that Bob's firm connected me with, where I spoke with. It's an interesting question because you would assume that you have complete access to your information, and when it's your information, you do. when it's someone else's information masquerading as you, you don't. So that's part of the reason it was surprising to me.
HIPAA protects the bad guy just as much as they protect you.
So if you find out that someone is using your medical identity, and if you get a bill for a facility you've never been to, and you go to the facility and say, I would like to see these records, they won't show them to you, because those are, once you tell them these are not my records, they won't show you somebody else's records, even if your information is on it. And I've spoken with Bob's help to a number of patients who, again, have agreed to be interviewed, who who've told me, they say, this is the most maddening part of the process, because I cannot expunge my data from this system because I can't see the record. I can't tell them, if the system is stubborn in changing the records, their erroneous information will exist in those health systems, which in many cases are remarkably unsophisticated, forever. I've talked to folks who've been a decade or longer with information in somebody else's system. So it's an interesting question, because nobody's really figured out how to purge your data from those systems.
Another reason why you have to protect yourself.
Yep. Yeah. Yep. I'm sorry.
I want to follow up on that, because in our interpretation of that incident, we would give that record out.
Yeah.
Because at that point, we're unclear about whose information that is, and we say this is your record under our interpretation. So I would say that's not a clear across-the-board rule. That's another person. We would be at that point. We'd say we want to establish who that person is, and that, and you are. It's you, and this connects. Well, you're coming in as this person. This record has your initial information, so therefore we think it's your record. We definitely have access to that.
Yep.
We can get, and then we would allow them to start that separation of the bad data from the good data. So I would say that's not true across the board.
Definitely not.
And that's one of the issues is hospitals have differing interpretations of HIPAA and what happens with that and its effect. And I would say on my perspective, they go overboard in what they're trying to do, and not really going to the spirit of what it's trying to address. So
Sure.
It can't happen in some hospitals. We allow that to happen in our hospitals to take care of that. I've actually done the situation.
And medical records that are maintained by private entities, most private companies consider that their IP, and whether it is about you or not. Now ownership of personal information is another thing, and I personally believe that the property regime is not appropriate, not an appropriate way of thinking about personal information. But you won't get access, like for WebMD, for example, or any of the other private entities. Don't have any particular right.
There's a question.
Usually.
Sorry.
I just wanted to follow up on Dr. Ross's point about multi-factor authentication. You talked about the end users when, I'm assuming, provider context of accessing information. I was just wondering, especially in the context of most seniors' Medicare numbers are their Social Security number or some derivative of their husband's or wife's, depending on the spousal arrangement. What are your thoughts about having a multi-factor authentication for when at the point of service, similar to a chip and PIN card in Europe, or something in that vein?
Yeah, we have this problem in the federal government all the time. We have multi-factor authentication has been a requirement since we had the HSPD 12 legislation, the executive order directive, but yet there's a huge disconnect when it comes to the millions of senior citizens being served by the Social Security Administration, for example, or the IRS and the taxpayers, CMS, exactly. You've got this mission requirement of serving those customers, and my grandmother, my mom, when she was 85, she could barely even understand what the computer was, much less use multi-factor authentication. So organizations are having to, our control catalog addresses a requirement from the internal agency perspective, what they have to do, and then we have another control for INA that deals with the external. And there are creative ways to kind of replicate that two-factor requirement, so you get more protection than just that weak password. But yet it's a difficult problem to deal with millions of, especially senior citizens, who maybe are not technology savvy. But yet the agencies we're doing new things now that are making that a little bit more effective. But for the rest of us out there who, use social media routinely. I think Twitter recently announced they're going to two-factor authentication. You got some of these companies like that who have recognized they have responsibilities with the data that they do. It's not healthcare data necessarily, but they still have that responsibility. So that's kind of where we're moving.
The question I have, so the movement in healthcare is making it much more patient-centered. And the prerequisite for making things more patient-centered is getting all the information about a single patient, assuming it's the real person, is at your doctor's office, your specialist's office, being able to find it all, at least, if not move it to the same place, have it all searchable, have everything better linked together. So you can, is that going to make, in the spirit of efficiency, is that going to make medical identity theft easier in some ways if things are more linked? Is that going to...
Not necessarily easier, but the chances of it happening to you
go up.
There's magnitude, because your data is everywhere. It's going to be in the exchanges. It's going to be, it's going to be everywhere. It wasn't that long ago that a data breach in healthcare was some doctor or nurse shared your file to 5 other people. So it was a 5-person data breach, right? Now it's 2 million, 5 million. TRICARE's was 5 million. Yes.
Far more potential nodes of failure, and the data will change formats many times. Every time you change formats, you have the potential for the data laundering. You have multiple nodes of failure, and then you have very often the technology that doesn't match up with the internal business processes. That you have something written down on paper that the procedure goes this way, but in reality it doesn't. So, yes.
I agree. The risk goes up immensely when you start aggregating all this data, and then you couple that with these new powerful electronic devices that we carry around all the time. One of the biggest impediments for the federal government going to the cloud is they're worried about the public cloud, sitting right next to data with your competitor or with potential adversaries. So, the bottom line in all this, if we ever want to see the medical record, electronic medical record, you're going to have to start with a solid foundation of privacy and security. So you get the trust. You remember the old credit card problem we had in the old days where if someone charged fraudulently in your card, you were responsible originally before the Congress said you're only liable for $50. As soon as they did that legislation, limited liability, the credit card use exploded, probably to our detriment now. We're overusing the cards. But the point is, consumers of medical or whatever we're talking about have to feel comfortable using the technology. Now, the problem I see today is that the smartphones and tablets, we're kind of flying below the radar. People are using these technologies without realizing the exposure that using that footprint is giving to them and people that they may work with.
Well, and actually, along those lines, I want to make a very important point about aligning market forces. The market forces all by themselves are really just not going to protect privacy. Here you have an example of a legislative fix that makes the financial industry internalize the negative externalities of credit card data, credit card fraud. And so you've aligned the financial industry's interest with the consumer's interest. And so you get those rather sometimes unsettling calls saying, is this you? And, your interests are aligned. That era dawned in 2004, 2005 with the breach notification in breach notification laws in California, where now industries in general had to begin to internalize that negative externality in the form of bad publicity, customer churn, and the other types of things. Now, there is, in the medical industry, in the medical world, I don't see that same alignment of interest yet, and I think we have a long way to go.
I think there are 2 more questions here. I think we'll go with you.
This is just tying back to the individual not having access to the fraudulent record or the fraudulent pieces of the record. Have you seen in Jordan, or maybe the case that you looked at, where the provider side or the hospital facility then also refuses to remove that information or extract it or even delete it ever, because as far as they're concerned, someone did receive care under these credentials, therefore for our liability, we can't remove this. God forbid we're sued in 10 years or whatever the case may be, or we have, certain, under Medicare or whatever, we have to keep this data for a certain amount of years. So have you seen that?
Right, I did see one case of this. It was a case in Southern California where, as luck would have it, or as misfortune would have it, the people were being treated at the same facility. So when it's different facilities, as we mentioned earlier, it's probably going to be easier for you to get your records fixed because they've never seen you, they know they've never seen you. But when it's the people being treated at the same facility, there's a real reluctance to provide data to what the facility might believe is a stranger.
Can I make a comment here, though? Because, this goes back to Nist perception back in 1998, when unique patient identifiers were approved. And then Congress voted to get rid of them. And so if there were unique patient identifiers, we would have this specific problem. And there is an entire industry that is based on attempting to provide an extra layer of probability to say that you're one of three people. And it creates that you're one of three people who live in 4 or 5 different places as the baseline for reacting in master patient indexes. And it's very, very expensive for hospitals and systems as they expand to coalesce these systems. Whereas if you just took everybody in the U.S. and you gave them a voluntary patient identifier, not a voluntary, not a required one, that they could then change. And then they say, and I've talked to Aaron about this, it's just, you like going into the witness protection program, you just go in, and what do you do with the credit card? The credit card's not that important. You just get a new one.
Yeah.
You get another set of random numbers that don't mean anything. Why would you ever want to tie this stuff into identity in that particular regard? Identity is important for providers, don't get me wrong. But for patients, we really shouldn't care that it's their name and it's their address and all that kind of stuff, as long as the information is valid to that individual.
Fair point. Just because we're running out of time, I know you've been wanting to get in, and we'll
Right. I just have
wrap it up.
a comment. The Kaiser Permanente system has been meeting customers' wants. They want to get their information. They want to access everything electronically. Aren't we going there with everything? And how can we protect everybody? Because it sounds like we're going to be all electronic at some point. How can we protect everybody's privacy?
That is the question on the table.
Yeah.
In 1 minute or less.
Right.
In 1 minute or less.
The privacy and security and ease of use, right? Usability, privacy, and security have orthogonal relationships. Privacy and security are completely aligned as long as you're securing the individual. If you're securing the institution, privacy and security are at odds. If you design it correctly, privacy, security, and usability can be complementary. But typically, increases in security represent a decrease in usability. So what we're doing is we're balancing those principles and others too. And there is not security, none of these three principles is a binary. And you combine them and they're most certainly not binary.
I think the problem is that exactly as you just stated, there's always trade-offs in everything, and it's all about managing risk. And unfortunately, unless you've been a victim of identity theft, or if you've ever lost some documents or photos because you get a virus, and you don't really have that, I call it the 2x4 in the forehead incident. If you don't have one of those, then you can fly along, fat, dumb, and happy and not really care about this stuff. I think at some point we're going to have a national discussion about this because it's going to be tied to how this whole electronic age goes forward, with health records being just one of those things. And there will be norms established, whether it's HIPAA driving that or FSMA, whatever the legislation might be, state laws. There will be a steady state that we will agree that represents, like in the legal field, they call it what would the reasonably prudent man or woman do. That's kind of the standard of due diligence, due care. I think we're going to achieve that in security and privacy as well. We have a lot of fundamentals with the FIPS and things that kind of inform us about those things, but we haven't translated that into the controls within the systems yet. And I think the people, as you said before, play a big role too. It's a combination.
And if I could just add, our view on this is there's no way we can protect everybody. You know, there's just too much going on out there, all the reasons we just talked about. But from my personal perspective, if you can't protect me, at least allow me to know it's happening. Just like we have credit monitoring for financial identity theft these days. You know, if somebody's using my medical identity, I want to know about it. I want to know about it tomorrow, today. So, you know, that's part of what MIFA is going to be talking about.
All right, I think we're out of time, and I think you set us up pretty perfectly. I'm sorry for anybody whose questions I wasn't able to get to, or anybody who I missed. But I appreciate everybody coming out and